Faster healing after wisdom tooth extraction, tips to prevent dry socket. After wisdom tooth extraction, it's important to take proper care of your mouth to ensure faster healing and minimize the risk of complications like dry socket. Here are some tips to help you heal more quickly and prevent dry socket. Follow post-operative instructions. Your oral surgeon will provide you with specific instructions for post-operative care. It's crucial to follow them diligently to promote healing. These instructions may include guidelines for medication, rest, diet, and oral hygiene. Control bleeding. Bite down gently on the gauze pad placed over the extraction site for about 30 minutes to control bleeding. Replace the gauze pad as needed until the bleeding stops. Apply ice packs. Apply an ice pack on the cheek area over the extraction site for the first 24 hours. This will help reduce swelling and discomfort. Take prescribed medication. Take any prescribed pain medications or antibiotics as directed by your oral surgeon. This will help manage pain and prevent infection. Maintain oral hygiene. Keep your mouth clean, but be careful around the extraction site. Avoid brushing the area for the first 24 hours. After that, gently rinse your mouth with warm salt water several times a day, especially after meals, to keep the area clean. Eat soft foods. Stick to a soft diet for the first few days after the extraction. Choose foods that require minimal chewing, such as soups, yogurt, smoothies, mashed potatoes, and soft fruits. Gradually reintroduce solid foods as you feel comfortable. Avoid using straws and smoking. Sucking through a straw or smoking can dislodge the blood clot from the extraction site and increase the risk of dry socket. Avoid these activities for at least 72 hours after the surgery. Avoid strenuous activities. Limit physical activities and avoid intense exercise for a few days after the extraction. Resting allows your body to heal more effectively. Don't touch the extraction site. Avoid touching the surgical area with your fingers or tongue, as it can introduce bacteria and delay healing. Stay hydrated. Drink plenty of water to stay hydrated, but avoid using a water bottle with a straw for the first few days. Preventing dry socket is of particular concern after wisdom tooth extraction. Dry socket occurs when the blood clot that normally forms in the socket after the extraction is dislodged or dissolves, leaving the underlying bone and nerves exposed. This can cause severe pain and delay healing. In addition to the above tips, it's essential to be gentle when rinsing your mouth to avoid dislodging the blood clot. Avoid vigorous spitting or excessive rinsing for the first 24 hours. Don't drink carbonated or alcoholic beverages, as they can increase the risk of dry socket. If you experience severe pain, persistent bleeding, or any concerning symptoms after wisdom tooth extraction, contact your oral surgeon for further guidance and evaluation.